know that the Indian population is a relatively high risk population. We have got higher cardiovascular risk and we are experiencing earlier cardiovascular events. If we compare our population to the West, we are having hypertension, we are having diabetes, we are having heart attack, strokes 10 years earlier as compared to the Western population. The elevated LDL-C levels are crucial due to their strong and linear association with ASCVD risk. This is a documented fact, a known fact, that every 1 millimole per liter, that is 39 milligram per deciliter decrease in LDL-C is associated with a 21% reduction in cardiovascular events. And we can see here there is good data with both secondary prevention, that means you had a heart attack or stroke in the past, or even primary prevention, that means you are at a risk, but you have not suffered from heart attack or stroke. So it is important to reduce, or based on every person's population, their basic characteristics, you should keep your LDL-C on the lower side. Trend lines for ASCVD in primary and secondary prevention are virtually superimposable. That means whoever are high risk definitely should benefit lipid lowering, and strongly and linearly associated with the absolute achieved LDL-C level. Now talking about the guidelines. The latest guidelines recommend to strike early, strike strong for intensive LDL-C lowering to achieve the targets in high-risk patients. We have the 2023 ESC guidelines, the CSI 2023 guidelines, and they tell us to reduce the LDL-C reduction to less than 55 for high-risk patients. In patients with a second cardiovascular event within 2 years, an LDL-C goal of less than 40 confers additional benefit. 2022 ECC expert consensus decision making with clinical ASCVD at very high risk tells us to reduce our LDL-C to less than 55 or LDL-C reduction to greater than 50% as compared to baseline. Now, very important, talking about our own Indian guidelines. So I am proud that, I am one of the advisors for the same, for Lipid Association of India, and we have really been working very hard in this aspect. And I would be talking about the 2023 Lipid Association of India guidelines. In fact, we have presented our data even in Chicago just 3 months back, and they have found that our guidelines are pertinent. Why it is important to have our own Indian guidelines? Because we are getting heart attacks, strokes, younger people with hypertension, diabetes as compared to the West. That's why we are at a relatively high risk. Hence, we need to treat differently. So, talking about the LAI 2023 guidelines, in very high risk cardiovascular risk, the LDL-C reduction of less than 50 milligram per deciliter is advised. Extreme cardiovascular risk, the category A, LDL-C recommendation to less than 50 or LDL-C reduction to less than 30 optional. Extreme high risk, that means imagine if you had a heart attack and you get a second event within 1 year of the initial presentation. In these patients, you should try to get your LDL-C reduction to less than 30. The very high risk, the category C, that means you had a block in the carotids, you had a stroke, you have heart disease, you have got block in the leg vessels, peripheral vascular disease. In such patients, even LDL-C reduction to less than 10 to 15 milligram per deciliter is advised. This is what we had presented last year. And believe me, it is safe. So how low we can go is also something that I would be talking about. No significant association between very low levels of LDL-C and safety outcomes. This is something that is important. So a secondary analysis from 4-year trial showed no safety concerns even if the LDL-C was less than 10 milligrams per deciliter. So if you talk about the CK elevation, neurocognitive benefits, which sometimes people are worried about, it is not statistically significant and the patients do well, they tolerate the drugs well, and you can actually get it down. So do not accept less Go as per the guidelines, what guidelines have to guide you.